We're going to show you some exercises that you can do at home to help with the symptoms that you have from frozen shoulder. These are an important part of your rehabilitation. They are designed to improve or to maintain the range of movement that you have in your shoulder. You can discuss how you're finding these exercises with your physiotherapist. Depending on which phase of frozen shoulder you are in, you may find that your approach to your exercises will be slightly different. If you are in the pain-predominant phase of frozen shoulder, it may be that your aim is to improve or maintain your range of movement and function rather than to improve it. If you are in the stiffness-predominant phase, it may be that you feel a little bit more confident to push into the stiff ranges a little bit more. Remember, the course of frozen shoulder can be a long one. Even if you're not seeing much progress, don't give up, as keeping the shoulder moving through its available range should help. Support your forearms on a table, kitchen worktop, or on the back of a chair. Step back from the surface and then bend at your hips, taking your shoulder into a forward stretch. Hold the position where you feel the stretch for 15 seconds and then slowly release. Repeat this 3 to 5 times. Sit on a supportive chair. Place a small folded towel between your waist and the elbow on your affected side. With your elbows at 90 degrees, hold a stick between both hands. With your unaffected arm, push through the stick towards your affected side so that it makes your forearm turn outwards. Keep the towel in place with the elbow whilst you do this. Move as far as you can until you feel a stretch and hold the stretch for 15 seconds. Slowly move out of this stretch. Repeat this 3 to 5 times. These exercises are useful for further progressions once you have regained some mobility in your shoulder. Put your hands behind your head. Pull your elbows back. This can be done in sitting, standing, or lying. If the stretch feels too much, put the back of your hand on your forehead. Hold the position where you can feel that stretch for 15 seconds and slowly move out of the stretch. Repeat the stretch 3 to 5 times. Place your hands behind your back. Move your hands up your back as far as you comfortably can manage. When you feel a stretch in your affected shoulder, try to hold the stretch for 15 seconds. Slowly move out of the stretch. Repeat the stretch 3 to 5 times. You can also try this exercise holding a stick behind you with both hands. Move the stick backwards and upwards as far as you can. Use your unaffected arm to help your stiff shoulder to move further by gently pulling through the stick. Move as far as you can to feel a stretch in the shoulder. Hold the stretch for 15 seconds and then slowly move out of the stretch. Repeat the stretch 3 to 5 times. You should try and do your exercises 5 days a week. This gives your muscles and joints time to recover on the other days. Some people find exercises easier when the shoulder is relaxed, for example after you've had a warm bath or a shower. If you're taking pain relief, do your exercises about an hour after taking them. It's important to take your time and work on the quality of your movement. If you feel that you're cheating, for example hitching your shoulder up to your ear, then try and control this if you can. The number of repetitions for each exercise is a guide. If it's not realistic for you to perform that number, then start where you can and gradually build up. You may find that exercise can make your shoulder uncomfortable, but some discomfort during exercises is okay. You should, however, listen to your body, as this will be important when you decide how to progress or reduce your exercises. Particularly in the pain-predominant phase, you shouldn't just keep pushing and pushing into painful ranges and making your shoulder more and more sore. To stay positive, focus on the progress that you've made over a longer period of time, for example, a month rather than a week.